Well, technology is opening up possibilities for easier monitoring of individuals' health in remote areas. According to reports, more than 400 million people in Africa have little or no access to healthcare. Healthcare policy drivers, experts and decision makers are taking part in a virtual event that focuses on transforming the sector. To discuss Africa's challenges and opportunities in digital health, we speak to Exhibition Director Ryan Sanderson, who talks to us all the way from London. Very good morning to you, Ryan. What can we expect when it comes to digital health and the sort of impact it can make on us here in Africa?
Well, it's always been a very key bridge between running and running a functional hospital. I think for us, what we're trying to do at the moment is obviously it's impossible to travel internationally, and a lot of what we would do as a business isn't format. We're very we're big in bringing people together to have face-to-face communications to try and solve some of these developing healthcare issues. And for us, it's obviously been a very tough time of late with a lot of the restrictions in place. So, what we typically do within a face-to-face setting, we are trying to do digitally. And from our perspective, I think that a lot of the connections that will be made over the course of the next week are critical.
Okay, how will it work?
So sorry, could you repeat that, please?
How will it work, the sort of digital makeup of this process of analysing someone's health and meeting their requirements?
Yeah, sure. I mean, I think especially over the last 10 years, there has been a real move towards embracing digital solutions for healthcare problems. I think we've seen that in hospitals across the world. The ability for hospitals to just be run in a more sort of just a smoother fashion, and in a way that is more cost effective, in a way that limits mistakes, and ultimately in a way that that assists the sort of patient safety and patient outcome. There's a lot of various technological aspects that go into that. We are making the most of what's available to us within sort of this new digital age, and that's allowing people to get together on a mass scale where they've never really been able to do that before through the development of technology.
I mean, this is really where we can exploit AI, isn't it? And I guess that's where it'll be really effective if you can get them into rural places, considering how few doctors actually make it out there.
It's a huge deal. I mean, the access to medicine, I mean, the potential to have an excellent qualified doctor on the end of a phone or the end of just the other side of a smart screen. If you are in an isolated community, to get access to that level of help it's a game changer. It really does open up world-class healthcare to people that have never had access to it before. So it's a tremendously exciting development.
I should imagine the key to all of this is strong collaboration.
Of course. I mean, these things don't come overnight. It's taken a long time to build systems like this. There are areas, there's infrastructure-related problems that sometimes are still faced within the African continent, and I think that there's got to be public-private partnerships that make this work. There's obviously a lot of training that goes into the successful uptake and adoption of these sorts of systems. So naturally, it is going to be a global effort. It is going to require a lot of collaboration, but ultimately, that's kind of what we've been seeing.
Well, good luck. We need you, Ryan Sanderson. Thank you.